everyone.
We'll be starting in 3 minutes, guys. So if you know somebody who's also another youth or young person, student who would benefit tremendously from this, the knowledge that will be shared on this platform, we ask you please to just connect with them, to share the link that you would have seen to join this platform so that they can also tune in as we start in another 3 minutes.
Blah, blah, blah.
All right, so it's 10:15. We're going to begin this meeting / forum, online forum, the first JUTS online forum Let me welcome all the persons who have joined us so far. We have 65 persons currently who have joined this online forum. We see we have a number of the student union presidents here from the various tertiary institutions. I notice we also have a few members of the Ministry of Education as well. We see that we have here Mr. Davey, who is the senior policy, who is the acting policy analyst in the Ministry of Education, Youth and Information. We have Dr. Who asking for persons who have their phone to just mute their phone, please, while we, whenever you're speaking, we'll ask you to just unmute so that we can hear what you say. Otherwise, oftentimes there are noise in the background, so we ask persons to just mute their phone. For persons who also aren't aware, your phone is muted upon entry, so not until you unmute it will people be able to hear what you're saying. So your phone is currently muted if you entered without pressing anything. All right. Now continuing, I will go over all the basic things about the platform again shortly, but just for now, we're just going through just to get this meeting started. All right, so it's called to order at exactly 10:15 as would have been stated. We'll just ask Kimon. Kimon?
Yes, sir.
Okay, Kimon, we're just going to ask you to just give a word of prayer just to start off this online forum.
Okay, let us pray. Dear Lord, as we bow our heads in your presence, we want to thank you for life. We want to thank you for all you've done for us. We want to thank you for your mercy, Lord. As we are gathered here as young student leaders, Lord, we pray that you will guide our meeting and discussion. We pray that, Lord, every conclusion reached will be according to your plan. Lord, as we try to address this pandemic with as much that we can, Lord, in our capacity as tertiary leaders. Lord, we pray that you'll guide us and that whatever we want to do, that you'll give us the strength to do it. Thank you for hearing and answering my prayer. Amen.
Amen. All right, we have a playing of the national anthem as we go into this meeting. It's a recorded audio, so just feel free to listen and to sing along. If you want, you can unmute your microphone during this time as we play the audio for the national anthem.
Justice to forever, Jamaica, and we love Jamaica, Jamaica, and we love. Just due respect for all. You strengthen us to be together. Give us vision lest we perish. Knowledge send us, Heavenly Father, and true wisdom from above.
guys, that was the national anthem. All right, welcome again for all the other persons who are joining us. My name is Everton Rattray, President of the Jamaica Union of Tertiary Students, which is the organization that is hosting this forum, this online forum to discuss COVID-19. Just giving my opening remarks, just to give also a recap of what this platform, the nature of this platform and how it works for persons who have never used this platform. Well, before that, we currently have about 77 persons on this platform. The platform can only hold 100 persons. So after that, no other persons will be able to join the platform. So we ask you to be careful of how you probably allow yourself to click the leave meeting button if you don't intend to leave the meeting, because you might not be able to get back onto the platform. Otherwise, from that, ladies and gentlemen, just to give you a run through of the platform, at the bottom, I know a number of persons who have heard this already, but just to go back through, the mute button is to the bottom left of your screen. You will see also the video button. So if you want yourself to be seen on the screen, you can press the video button and yourself will be allowed to see yourself on the screen. Otherwise, from that, you can also press your mute button. For persons who are just joining, the mute button, you're automatically muted upon entry to this platform. So to speak, you have to unmute yourself. We ask, however, that you mute yourself during the process when somebody else is speaking, and when you intend to speak, you can raise your hand and we acknowledge the persons, because I'm notified when anybody has raised their hand, so that I can acknowledge you so you can speak. Apart from that, there's also some other features such as the reactions. The reactions allow you to give a thumbs up to something that you might agree with that would have been said, or to give a round of applause for something that you find profound that you're in support of. You can feel free to test those features now again, just to see if they're working. You should see come up on your screen. Okay, perfect. I see persons trying it. Okay, so you should see come up on your screen. Otherwise, from that, this program will be in two sections. The first section of the program, Dr. Hope will be speaking on what is COVID-19 and how us as young people can help to fight COVID-19 from where we are in our various institutions and where we are overall. We have a person here with us from the Ministry of Education. We want to just welcome not Dr. Davy, but Davy Horton, who is the acting senior policy analyst in the Ministry of Education, Youth and Information. We also just wanted to thank Dr. Hope for being here with us today, just to speak about COVID-19 and just give us a little history on it and how we play a role in that. Apart from that, if you look on the agenda, for persons who are just joining, the agenda is in the chat. You should be able to see the agenda. If you're not seeing the agenda, I ask that somebody just repost the agenda. I think O'Neill had just reposted the agenda in the chat. I just ask if O'Neill, you could just do that again. You will realize that the introduction of Mr. Hope will do the introduction from the Ministry of Health. Then we'll have, just to speak though, Mr. Hope is not directly from the Ministry of Health. Mr. Hope is currently working at the, remind me, Dr. Hope, please, working at the
University Hospital of the West Indies.
Yes, the University Hospital of the West Indies, which is actually one of the facilities I'm sure that is able to detect the virus in particular, right?
Yes.
But Dr. Hope will be speaking more with us shortly, just giving you a run through of the agenda. Then he will speak about what is COVID-19 and just bring awareness to that. Then we allow you to ask your questions. All the questions that you might want answers to, Dr. Hope will be able to help to assist us to answer those. The Minister of Youth will also be joining us shortly. So you may feel free to ask the Minister of Youth, that is the Honorable Orlando Terlong, the State Minister of Youth. So we ask that you can ask your questions to him as well. He'll be joining us for about 30 minutes just to answer your questions, because we know young people have several questions that they want answered. So that is the minister will be joining us to answer those questions. Mr. Dave is also here, who is from the Ministry of Education, the policy analyst. So you can also ask him some questions. He's also one of the coordinators, or the coordinator for the ministry, for the Jamaica Union of Tertiary Students. After the question and answer section, we'll move into the last section. And the last section of the program will speak to us developing a national plan of action, and also which will basically speak to the recommendations that we are putting forward to the government, and also the recommendation that we are putting forward to our tertiary institutions. So at the end of it, we are asking persons to put forward questions and also put forward recommendations, because all these will be noted, and I believe they will add value in whatever way we can. I know persons are asking about what will happen to their degree program. Will they have to stay in school longer than the period that they was expected? All these are questions that I hope the minister can help us to answer, and also the persons who we have within our expert area will be able to answer. So we will just get into it. We'll move into our first section where we'll ask Dr. Hope to just introduce himself and, just to go into what is COVID-19. If you are all aware and like to us to begin, just show a thumbs up so we can see that we're getting there, please. So show a raise of hand so we can have our first presenter going. It's down the bottom, the reaction signs. Perfect. We're seeing persons sending those thumbs up. Perfect, perfect, perfect. All right, guys, so we're almost at our maximum capacity, which is 100. So we are at 82. So if you know somebody who wants to join us before the platform doesn't allow anybody else to join, just feel free to message that person right now. So Dr. Hope, the floor is yours.
All right. First, let me say thank you, Mr. Rattray, for this opportunity, and thanks to the Jamaican Union of Tertiary Students to address you. I'm Dr. Jason Hope. I am currently a postgraduate student in the orthopedic program, DM program, through the University of the West Indies Mono Campus. I'm currently stationed at the University Hospital of the West Indies as my place of employment. And first, I will give you some background as to coronavirus, as it's commonly called, but COVID-19, the timeline of its development and how it has been impacting the nation of Jamaica so far, and what we as individuals and you as tertiary students can do to assist Jamaica as a nation responding to this pandemic, as it has been declared by the World Health Organization. So I'm sure many of you know already that the coronavirus or COVID-19 actually originated in Wuhan, China, and it was first diagnosed the 31st of December, where a patient presented with a case of pneumonia of unknown origin, and further investigations into that case yielded the isolation of what we now call COVID-19 virus. The coronavirus is not a new virus. It has been around, and I'm sure many of you have heard information about that. But the timeline of its development, it is now 74 days from the diagnosis of that first case. And currently in the world, we have, can you believe this, 142,320 confirmed cases. That's in the space of 74 days. And we have had included in those cases, unfortunately, 5,388 deaths. And that is the current information available on the World Health Organization platform. So this COVID-19 pandemic is not something to be taken lightly. And in the space of those 74 days, it has already affected 129 countries and territories in the world. Of course, including Jamaica, which is one of these territories. And we are actually listed on the World Health Organization as one of these countries affected with 7 cases, according to the World Health Organization. Coming a bit closer to home, as the development of COVID-19 unfolded, we had it being declared by the World Health Organization as a public health emergency of international concern, and this was done on the 30th of January. And then on the 11th of March, which was Wednesday this week, it was declared as a pandemic. So this is the timeline of development for the coronavirus. And I'm sure many of you may want more information as to what the virus is and how it presents, and then how we can help to curb its spread in Jamaica and across the world. So just some very brief information. The coronavirus is actually part of a family of viruses, which are called the coronaviruses, and it is responsible for usually respiratory conditions, respiratory diseases. Some notable diseases include the common cold, which is caused by the influenza virus, which is part of the corona family. It also presents with the MERS, which is the Middle Eastern respiratory syndrome, or SARS, which is more common and more recent presentation, which is the syndrome of acute respiratory disease. So coronavirus falls within this family. and it therefore is transmitted usually through the aerosolization of droplets from the respiratory tract. And these droplets can then rest on surfaces, and persons who then contact these surfaces can help to disseminate and further spread the virus. And I'm sure the question we are all asking is, one, how do I know I or a person I come into contact with may have contracted the coronavirus? And then we will look at how we can protect ourselves from this virus and how we can help to limit its spread in the population. All right. So all of this information I'm giving you is readily accessible through the Center for Disease Control, their website, and also it's also accessible on the World Health Organization and their website. So, of course, as this has unfolded over the last 74 days, there has been a significant response on the international level to do research to try to better understand the virus, how it presents, the usual timeline, the natural history of the virus. And as you can imagine, it is a short time we have had to investigate this virus and to glean this information. But so far, we know that persons tend to present symptoms within 2 to 14 days of exposure to the virus. And these symptoms, as said before, tend to affect the respiratory tract, which is your airway and your breathing. So patients usually present with common symptoms of fever. They can also present with a cough. They can also present with shortness of breath, which is difficulty breathing. And there are other symptoms that can suggest that the presentation is more urgent and severe and that you should therefore seek urgent medical help. But the most common symptoms, as said before, are fever, cough, and shortness of breath. And just to state again, this is usually within 2 to 14 days of exposure to the virus. And it is important to note that there is an asymptomatic period, which is what makes the virus even so more concerning, because even though you may have been exposed and may have contracted the virus, there's a period where you now become a carrier and have no physical symptoms to suggest that you have been infected. And this is I believe, the major reason that has led for the dissemination of the virus internationally, because of course, persons having contracted the virus would have been traveling and they feel well, they feel normal, but they are not only infected carriers, but they're also potential spreaders of the virus. And this period of asymptomatic illness is variable, but usually it lasts for sometimes as much as 10 days. So even 10 days after you have contracted the virus, you will feel normal. You may not have the symptoms of fever, cough, shortness of breath. So this is something that is important and also underscores why you need to protect yourself and take certain precautions, because you may contact people in this period who have no symptoms to suggest they have been infected. And therefore, to protect yourself, to protect your family, to protect your organization, you have to take these precautions, and we will speak to these precautions a little bit later. Just to speak a little bit more about the symptoms, of course, there are certain symptoms that suggest that the presentation is more severe. And in this situation, we would not advise that you manage it by staying at home by self-isolation. If you have these symptoms, you should first follow the protocol that has been given by the Ministry of Health, which is to report the symptoms you're having through the hotline that is available, 888-1-LOVE. And then they will give you instructions as to how to act accordingly. So if you have symptoms of difficulty breathing or shortness of breath, if you have persistent or severe pain in your chest, if you have confusion, if you know that you're becoming a bit disoriented and losing track of time, or if you begin to have blue discoloration of your lips, these are all now symptoms that suggest that the disease is having a moderate to severe impact on you as a person, and you should therefore seek urgent medical help, okay? And of course, we'll pause for the end for any questions or concerns, and I'll be willing to address these questions then. And now the crux of this presentation, I again want to acknowledge the presence of certain persons here. Again, thanks to Mr. Rattray for giving me this opportunity, also acknowledging Mr. David Houghton, who is representing the Ministry of Education as their senior analyst. And also all of the student leaders who are a part of this population. I want to acknowledge you now because you are extremely pivotal in how Jamaica as a country can respond to this pandemic and how we can help to stem its further dissemination into the population and persons becoming exposed unnecessarily. And I start this next segment of the presentation there because the prevention of the spread of COVID-19 is not a national problem. It is not a Ministry of Health problem. It is something that we all as individuals have to see ourselves as stakeholders and shareholders in preventing the spread of this disease. And therefore, everything we do plays a part. And I really believe that for Jamaica to curb, and there are examples around the world of countries who have been able to stem the spread of COVID-19, countries such as Singapore, countries such as Hong Kong, who even though they contracted cases of COVID-19 early in the timeline, they have not had a significant increase in their population. And this key factor, I believe, that helped these countries to prevent the dissemination is one, the level of education, and therefore all of you are important in that, and also the compliance of their population to follow the advice given by their authorities, their health authorities, in how to manage their lives and manage themselves. And therefore you have a significant role, not just in receiving this information, but ensuring that you disseminate it as well. So the important things, the Minister of Health has been underscoring this, the Prime Minister of Jamaica himself has been underscoring this, the importance of certain hygienic practices in preventing the spread of COVID-19. And that is the most significant and important thing that must be emphasized, that because it is a respiratory virus, the spread through the aerosolized droplets is something that can be stopped by using hygiene. We will look at it in two veins. We will look at what persons who are infected are believed to be infected, what they can do to prevent dissemination, and what we assume to be asymptomatic persons who have not been exposed, what we can do to prevent ourselves from contracting the virus and to keep ourselves safe. So starting with us who we believe have not been exposed, the most important thing is proper hand washing techniques. And this involves washing your hand with soap and water. And this is not what a regular Jamaican where you just splash your hand under water and you rub it together. They advise that you should wash your hand for at least 20 seconds. And what you can use as a gauge of this timeline is to sing the happy birthday song. Some persons say if you sing that song twice, that usually equates to roughly 20 seconds. And that is the duration you should wash your hands to ensure proper removal of any contamination. And this should be done as frequently as possible.
Which one of the happy birthday songs?
The international, the happy birthday to you, that one. I know there's a Jamaican version. We'll have to test that to see if it equates to the same 20 seconds. So proper hand washing techniques is the most critical practice that we need to adopt in this season. And that involves once you have come into contact with any surface, whether you believe that surface may or may not have been exposed, you should practice frequent hand washing. And I would advise for those of you, whether you are on campus, whether you're living in your personal home, as soon as you arrive home, you should wash your hands as soon as you enter your home. And again, once you are away from your home and you are moving around contacting surfaces as frequently as possible, you should practice washing your hands. And that is the most important thing. In addition to proper hand washing techniques, you should also practice the use of hand sanitizers. And these should be alcohol-based hand sanitizers. And the alcohol content is recommended to be above 60%. So 60% ethyl alcohol in a hand sanitizer should be sufficient to kill any viral particles that may be on your hands or on after you've contacted surfaces. And I encourage you as well to exercise wisdom. So when you're purchasing your hand sanitizer, when you're going to try to source, ensure that you read the labels to ensure that the alcohol content is appropriate. All right, because this is very important because you need a specific alcohol content, which is of 60% ethyl alcohol to effectively eradicate the virus from after use of hand sanitizer. And the next advice is, in addition to washing your hands, in addition to using hand sanitizers, you should avoid contact with your face and your airway, which can then introduce the virus into these areas. So avoid and contact with your mucous membranes, which include your eyes, your nose, your nostrils, your mouth. You should avoid contacting these areas as much as possible. All right. And I will share personally, you see me wearing glasses now, and I'm still working. And as medical professionals, we are still required to report to work and to do our responsibilities. And I have taken a personal decision to stop wearing my glasses, because I know that that is a trigger where I may inadvertently touch my glasses, touch my face subconsciously. So as many steps as you can take to protect yourself and to remind yourself to avoid contact with your face, you should take these precautions. All right, so now let's address persons who we may believe have contracted the virus. We hope none of those persons are on this forum, but we as persons may come into contact with these persons, so we must also be equipped with the information. So any person who has contracted or believes they may have been exposed to COVID-19, you now have to take the precaution of preventing that virus from being disseminated from you to other persons you contact. And therefore, it's recommended that any person who believed they may have been exposed or has been confirmed exposed, you should wear a mask to prevent aerosolization of these droplets from your mucous membranes to the atmosphere. All right? So that, and we hope any person who thinks they may have been exposed or is exposed, they should in truth be in isolation or quarantine in an appropriate facility under the control of the Ministry of Health and under the watch of a public health officer appropriately advised by the Ministry of Health. So any person in this forum, if you think you may have been exposed, or if you think you may have come into contact with someone who is exposed, I encourage you to report this to the appropriate hotline by the Ministry of Health, which is 888-1-LOVE, and to allow them to give you the appropriate instructions. Please do not take it on yourself if you think you've been exposed to go to a private doctor, to go to any public facility. Please first report it to the appropriate channels and then follow the advice, because you, if you have been exposed, can become a risk to all the persons you then come into contact with in you trying to present to a health facility. All right? Now for us, if any of us then begin to develop the symptoms I described before, which is the fever, cough, shortness of breath, it is advised that after you have reported it to the online, as said before, you should then engage in self-isolation. So you should stay at your home and you should isolate yourself for a period of at least 14 days so that we can see if your symptoms begin to develop or begin to worsen. So you should stay at home if you believe you're sick. If you believe to develop cough, sneezing, shortness of breath, fever, you should stay at home after reporting. And that should only change if you're given other instructions from the Ministry of Health or the hotline after you have contacted them. All right? And the last important thing is to ensure that you clean and disinfect all areas with appropriate techniques. And I have here as props, this is not a product bigging up any particular product, but we have different things we can use like Lysol disinfectants, which should have the appropriate alcohol content to decontaminate any surfaces. And you can use also bleach in the appropriate dilution to clean all surfaces. And of course, you can use your regular rubbing alcohol, which must of course have the appropriate alcohol content of more than 60% to disinfect any surfaces that you think may have been exposed. All right, so it's important that we protect ourselves, and it's important that we all invest and see the importance of my role in preventing the spread of this pandemic, COVID-19, and that we have a role to play. And as the final part of my presentation to you, I again thank Mr. Rattray for this opportunity. And one of the things he shared is that this is a forum for tertiary students, tertiary leaders especially, and therefore you are all pivotal in how we as a nation respond to this pandemic and how we as a nation can try to prevent its spread and to control its spread even. So you all as student leaders have a platform that you can use to not only help to allay some of the fears that may be developing in the society, but also to to disseminate accurate information to the bodies that you leave so that they can begin to practice and adopt these habits to protect themselves. And by protecting yourself, you further protect the society of Jamaica. So you as a student leader, you are pivotal, you are essential, and you are, I believe, the front line to how we can stem the spread of this pandemic. And yes, the Ministry of Health is doing what they can and doing what they are stipulated to do. And we as health professionals, we are protecting ourselves and addressing patients as they present. But the significant thing, and one of the things we can commend Jamaica for so far, of the 8 cases that have been diagnosed in Jamaica, there have only been 2 cases of local spread. So far, 6 of the cases that have presented are imported cases, where patients, through their travel history, have traveled to countries where there's a significant outbreak of the COVID-19, and we believe they contracted the virus there and brought it back to Jamaica through their travel history. Unfortunately, we have documented 2 local cases where patients have come into contact with what we call patient 0, who's the first patient diagnosed with the COVID-19 virus here in Jamaica, and that was on Tuesday, the 10th of March. And she contacted 2 persons, and now they have presented, they have been diagnosed, and they have been appropriately quarantined. I highlight that point because even though the Ministry of National Security has declared Bull Bay, St. Thomas as now an area of disaster, and they have taken the appropriate steps to quarantine that area, we as a nation still are not sure if all persons who may have been exposed are contained in that area. And therefore, it is essential that the entire nation of Jamaica takes these precautions. And I believe each of you as tertiary leaders should use any platform you have, any medium you have in the next few days to disseminate this information to as many persons as possible. Use social media, use all platforms available to you so that persons can begin to adopt hand washing, adopt hand sanitizing, adopt decreased touching of their face and their areas. And I therefore believe that the national response to COVID-19 is really equivalent to your response as a person. So I believe that as many persons as begin to disseminate this message, that the nation's response is as effective as your personal response, then we as a country can hopefully stem and prevent the spread of COVID-19 in Jamaica. The last thing I will share, and to show you how real and how dynamic this situation is, I was leaving the hospital a few minutes ago, heading home and driving on the university campus of the West Indies. And I actually saw a number of students, a group of students who were preparing to leave campus. There were coastal buses provided for them, and you could see their luggage, and you could see these students were preparing to leave. And as tertiary leaders, this is something you'll be confronted with. In fact, the Ministry of Education may not have given this directive, but certain tertiary institutions, UWI, which I'm a part, has given directive to students from other territories. They've been given the go-ahead once they have consulted with their consulate in Jamaica and their Ministry of Health in their appropriate territory. They can return to their country as guided by their Ministry of Health in their country. So I know that a number of students would want to take this option to leave. However, I would advise you to take the necessary precautions, because as you would realize, the dissemination of COVID-19 has happened because of international travel. Travel in cruise ships predominantly, but also international air travel. So you, in traveling to your different territories, will be exposing yourself to the potential of contracting the virus, and therefore you should take the necessary precautions. As I said before, frequent hand washing, sanitizing. If you can also source any of the sanitization wipes so that any surfaces you contact, before you contact them, you try to sanitize those surfaces. And for us, for tertiary level leaders who will be still on campus, still on the ground, still here in Jamaica, your role would be to advise persons, if they plan to leave, to take necessary precautions, and also to advise persons that it is also still safe to stay in Jamaica. Yes, there are confirmed cases here in Jamaica, but once you take the necessary precautions, you can protect yourself. And once you practice the advice given by the Ministry of Health and the CDC and WHO in proper hand washing, sanitizing, and disinfection, you can protect yourself and remain safe from COVID-19. All right, so I thank you again for this opportunity. I thank you for giving a listening ear. And most importantly, I hope that you take this information and you disseminate it as widely as you can. And even more important than dissemination, I hope that you now adopt these practices personally, and that you, in your persons in your sphere, you also encourage them to adopt these practices so that we can help to stem the spread of COVID-19 in Jamaica.
Okay.
Thank you.
Thank you very much, Dr. Hope. I really appreciate that. You have shared a number of things that I know a number of persons were probably asking questions about those things. In particular, you shared about even just a simple thing of washing your hands and how long you should wash in your hands is something that was, a lot of persons, we practice just a few seconds, just rub the soap in your hand quick and wash off. That 20 seconds of washing of hands is really important. And you have shared several other things. Before I continue, I just want to recognize also Dr. White is also here with us, who will also be tuning in just to answer questions as well as we go along. We know Dr. Hope have just shared with us basically what is COVID-19 and where it's coming from. Now, people, just before we continue also, we have reached our maximum capacity, meaning that we can't hold anybody else on the forum. The maximum for this forum is 100 persons. So if you know other persons who might want to tune in, they might have to go on our live. We're going to stream it live as well, so persons be able to see through our live who can't join or the direct platform. Apart from that, we will now ask Dr. Hope and Dr. White to just answer just questions that students might have as it pertains to what is happening currently with COVID-19. The minister just messaged me. He will be joining us shortly as we go into that section of the program of just answering the questions. We'll acknowledge the minister when he arrives. Until then, we'll just ask Dr. Hope and Dr. White just answer the questions that students might have. What we're going to do is ask you to just raise your hands if you have a question, and then we'll acknowledge you. There's a raise your hand sign. The minister is here. Welcome, Minister Terry Long. I think he's connecting his audio. Right, until the minister connects his audio, we will just continue. Just raise your hands if you have questions. We'll allow Dr. Hope and Dr. White to just answer those questions. And Mr. Davey, you can also tune in as well from the ministry standpoint. And I know the minister is here. The Minister of Youth is also here to just answer any questions that you might have. You might also have. We will allow the minister also to just give a few seconds just to introduce himself or to say anything that you might just like to say before we go into the question and answer section of the program. Minister, welcome. You have to unmute, Minister. You're muted upon entry. So look down the bottom of your screen, you should see to the left, the unmute button.
All right, good, yeah, got it. Good morning, Mr. Redcher, how are you doing?
I'm wonderful, Minister, it's good to see you.
Nice, good to see you too, and good morning to everybody else who's tuned in. Question, is it, let's see, no, it's still morning, because it's 2:11. All right, first of all, I must congratulate you and the team for having organized this Zoom session. I see the Jamaica, I see the JNWay logo behind you, and of course, we always want to big up JN, for supporting the ministry and certainly for supporting the Jamaican youth generally. So COVID is here, and well, certainly what we've been trying to do as a government is to ensure that we take a very proactive approach to how we deal with the virus. The aim, of course, is to contain the spread of the virus and to ensure that all Jamaicans are in fact safe. I mean, I must implore everyone again, including our tertiary students, that at this time, we've indicated, please do not panic. I mean, we understand that persons are apprehensive and that's completely normal, but we don't want persons to panic, just trust that we are doing what we need to do to ensure that the virus is in fact contained. There are measures that we will take that will not be pleasing to every single one, but understand that every single thing that we do is in the best interest of every single Jamaican, in the best interest of our country, in the best interest of our children, the elderly, our workforce. I mean, obviously, our healthcare professionals who've really been on the front line, our security forces, and we want to thank them as well. And just to thank, I think, the vast majority of Jamaicans from what we've seen, they appreciate the efforts that have been taken so far. And, you know, it's one Jamaica, Ratri. And I tell people all the while, you know, the divisive tactics, no, is not the time, you know, for divisive tactics. It's about, you know, together we will survive this, together we are stronger. And it's really one Jamaica for all Jamaicans. Yeah.
Okay, I really appreciate that, Minister. I really appreciate that. We're going to just ask, now we'll just open the floor, Minister, for questions. We have Dr. Hope with us, Minister, from UWI Hospital. We also have Dr. White with us as well, who will be helping to answer questions. You, along with the other, along with Mr. Davey as well. We ask persons to just raise their hands and we will acknowledge them and then we'll allow you to speak. We ask that you do not just speak out of random terms because we're trying to have this organized as best as possible. So if you'd like to speak, I ask you to raise your hands, please. I think I have noted that 2 persons have raised their hands so far. Let me a second. All right, so we're seeing that Abigail White. Abigail, could you just unmute your microphone and feel free to ask a question? Abigail? Abigail? Perfect. We're hearing you, Abigail.
Okay, great. My question initially surrounding the extension.
Could you just introduce yourself? Yeah, man, we're hearing you. Could you just introduce yourself, where you're from, and just go ahead and ask your question?
Okay, my name is Abigail White. I attend the University of the West Indies, the Western Jamaica campus. I'm currently on the Guild Council at my university. And that's enough, right?
Yeah, that's okay, Abigail. Go ahead. Just go ahead. That's all.
Okay. And my question is, the university had put out a statement saying that because of the infection going around and everything, school will be closed up until the 14th of April. I understand that maybe this is open to change depending on how the virus goes. But if it is that it is until that time, will the time for school be extended, or is it that they're going to implement online classes?
Okay, thanks for your question, Abigail. I will allow the minister to just probably comment on that. I know you can't speak directly for the university or what they will do, but I know there are probably some sense of direction that you can speak to that might take place for tertiary sector.
All right, so are you hearing me, Everton? I'm hearing ringing.
I think that, still hearing that ringing?
No, it stopped. So you can hear me all right?
No, man, hearing you clearly, Minister.
All right. Well, you know, it's very interesting, but in a weird way, what the virus has done is to pretty much catapult us even further into the 21st century. You know, so we've been speaking about the 4th Industrial Revolution, we've been speaking about STEM, we've been speaking about technology and advances in technology. And really, you know, I mean, I recall persons started the discussion about flexi hours and being able to work from home. We've been speaking about e-learning for a few years now and being able to, you know, well, distance education, we call distance education, being able to just, you know, log in online and, you know, learn. Certainly, we have a lot of programs coming out of the UK. For example, the University of London, you know, they have programs where Jamaicans are right here at home and they're doing, let's say, law degrees for 2 or 3 years online. So this has pretty much catapulted our own local society into that realm of the 21st century and how we educate our Jamaican youth. So what we have been encouraging at this point in time is e-learning, you know, learning online. I know from the discussions we've had with the major tertiary institutions that they have been able to conduct some classes online. And certainly we're encouraging all our tertiary institutions to move to that platform during this time. It also simply means that as a government, we must take steps to invest more funds into technology, just to ensure that when we think of our urban youth, when we think of, persons from marginalized communities, even within, of course, rural settings and urban settings, that we ensure that the technology is there so that in the event of another communicable disease such as this, that we do have the requisite technological infrastructure in place, that classes can be conducted online and that even work can be done online. I made the comment recently when I was actually in Montego Bay that, gone are the days of, let's say, for example, that kind of sugar industry, garment factory type thing. It is the technological era. And if Jamaica is going to play its part in a modern technological society, then certainly even what we're doing here now, this Zoom meeting, the virus has shown us that, listen, when you have persons in a boardroom, 20 people, 40 people, much of these things could be conducted remotely, which is what we're doing now. I tried to log on earlier, Everton, and I saw it said 100 persons, and I wasn't able to join in. But certainly, if we can have 100 youth on a platform such as this, having this meeting and discussing ideas, it certainly sets the tone as to what we can expect going forward. So naturally, within 10 days of Wednesday was a press conference, so 10 days therefrom, we will do an assessment based on the numbers. As indicated as a government, it is our responsibility to ensure that we conduct the quarantine phase in a manner to risk the community spread of the disease. So certainly if everyone does their self-isolation, self-reporting, if everyone avoids large crowds and avoid mass meetings, then certainly we will have a better idea as to see how far the virus has in fact spread, and we can take better measures to contain, curtail, and also to treat those who are sick. At some point, we will return to normalcy, but certainly there is a new technological normal, and certainly what we are doing here in terms of this Zoom and all the online educational classes that are going on, that will become a new norm in our education system. And certainly we are looking at some $50 million right now on our initial assessment to make sure we can build out more e-learning platforms. Speaking non-tertiary, already you would have seen we've been posting online as it relates to our, for example, PEP students. So certainly all their material is online. We now encourage parents and caregivers to say, listen, practice, classes, all our teachers, principals, they're on board. Students are getting up in the mornings. They will have to do that next week. They are aware, and they will be classes as usual right from their homes. I really have to big up Flo for coming on board on day one. Of course, one-to-one learning. Of course, Gordon and the Edifocal team, I have to big them up as well. And, all our partners. And I have to big up JUTS as well, because this is really phenomenal. And I'm glad that you've taken the initiative. When we speak of our youth as leaders and empowering the other youth and empowering society, this is exactly what we expect to see. So, big man thing. Kudos to you and your team, man. I'm loving it.
Appreciate that, Minister. All right, so so the Minister just answered the question of how we treat with going forward with possible programs, as he's speaking towards the idea that we might have to look at online schooling is the possibility that we probably will be facing going forward, probably to the ending of the semester. We can't, as the Minister said, he can't speak to exactly what will happen, but the online schooling seems to be where things will be going, right? That's what the Minister is really saying. Just to go again, if you want to ask a question, just raise your hand. There's a button down the bottom that you can use to just raise your hand. When you raise your hand, we will look in the chat to just see the person that will acknowledge you and ask you to speak. So, Minister, one of the questions that I wanted to ask in particular, I know you mentioned the budget. You said $50 million of somewhat is available for persons, for this in particular. How will we treat with the situations for international students that currently can't return home, but they have to be here in Jamaica currently, but they're asking to go back home? Also, how will we treat with persons who can't leave campus and want to leave campus, but they're not in a financial position to leave campus? Is there anything from the ministry standpoint to assist with students who can't afford to leave at this time. And because the universities are asking persons to leave the campuses, to return home, because they don't have the resources to host them on campus. How do we treat with that, and how is the ministry looking to help with that particular situation? Dr. Hope, we know you're here still, and Dr. White, guys, feel free to pose questions to them. I just posed another question to the minister, all right?
All right, well, certainly you have to remember that there's a different governance, in terms of the governance structure of the, let's say, for example, the university. It's a little different, but the overseas students were, as far as I'm aware, overseas students were told that accommodations would be provided for them. We do understand the need to limit travel at this point in time. So I'm not aware of any overseas student who has been asked to leave. Certainly from our discussions, overseas students were in fact told that they could remain on campus. The question is, as it relates to students who, let's say you're boarding at Mona, but you live in Mandeville. Should you go home to Mandeville? Again, it becomes a question of the discretion of the university. Naturally, when we think of the will be limited over the next 14 days, we would not want for students to be trapped on campus with no access to food, depending on what happens in terms of water supply, based on whatever things the campus itself would have put in place, in terms of maintenance staff and bathrooms and all those things. So that is a matter for the discretion of the university. From a ministerial perspective, we had the discussion yesterday, so we are going to see what can be done at this point. But the question is, in terms of accommodation, remember that there's a discretion that must be used by the university. Certainly, if there are students who perhaps, let's say they live in Bull Bay, for example, and they're boarding on campus, then certainly I don't believe that the university, in its discretion, would say to a student, knowing that that 7 and 8 mile area in Bull Bay has now been quarantined for the next 14 days, to say, well, you have to go home. It's a matter of discretion, and we expect discretion to be used in the best manner and in the best interest of all of students. And certainly we have the University Guild, we have JUTS as well, and we expect you all to advocate to the relevant university personnel as it relates to special cases in which students could be accommodated. But it will become a question of capacity and maintenance over the next 14 days and what they have put in place at the university level. For ministerial and government level, we are dictating protocol, and again, to make sure that we minimize the spread of the disease.
All right, Minister, thank you for that answer. As I said, guys, we're basically at our maximum capacity. We just realized that there are 2 spaces that opened up. So if you know somebody who wants to join, again, feel free to indicate to that person. But if you have your questions, as I say to you, you can just feel free to raise your hand just to ask questions. We have Dr. Hope with us, as I would have mentioned, for persons who are just joining. The Minister of Youth is also with us, and Dr. White is also with us. And Mr. Davey is also here with us, the acting senior analyst and policy analyst in the Ministry of Education, Youth and Information. So just feel free to raise your hand. We see that there's a hand here. Patrick.
Everton.
Yes, Minister.
Sorry, before you go to that question, and just to indicate that as it relates to our CARICOM students, any concerns that they have as well, they can contact their high commissions or their embassies, and other international students, they can contact their embassies as well. Their embassies would be in direct contact with the Ministry of Health, and will definitely have more details as to what their local embassies will in fact be doing to ensure their safety at this time. All right, so that's an avenue that they can take to consult their embassies, which are in direct contact with the Ministry of Health. And of course, we've issued the 888 One Love numbers and new numbers and new emails. Again, anybody who has any concern as it relates to their health and safety, please contact the Ministry of Health, contact us at all the numbers, send us an email, persons are manning the emails, JA-COVID-19 at Gmail and the other email address as well, all right?
Okay, so you just mentioned, guys, just to recap, it's very important that you note this number. It's One Love. You can call, that's a toll-free number. You can call that number and you're able to basically speak, and any situation, problems you're facing, you'll be able to speak to them directly through that number. Just to repeat it, it's 888-1-LOVE. 888-1-LOVE. So we're going to now take another question. Patrick Bingham was asking a question. Patrick, feel free to speak. Patrick?
Hello.
Go ahead, Patrick, we're hearing you.
Okay, I was asking, what is the impact that you think that this virus would have on the whole work and travel program?
Dr. Hope, would you like to address that?
Sure. Firstly, it would be foolhardy to think that the entire world will not be affected by this virus. It has already affected 129 countries, and based on the current trajectory, I believe all countries at some point, in some way or shape, will be affected by COVID-19. And I believe that the most critical period is the next 14 days, 30 days, where we will be able to gauge what's happening in certain high-risk countries, especially, including the United States of America, including the UK and the European Union, which I believe are the primary sites for the work and study program. So I anticipate that the program will likely have to be suspended until at least the next month, where we can see how countries have begun to respond and even control the spread of COVID-19. And as said by the Prime Minister yesterday, normalcy will return, but what is critical is this next few days where countries in different phases of their response, quarantine, control, or even collateral damage assessment and control, to see how these countries can best bring the epidemic and pandemic of COVID-19 under control. And then once that normalcy has been established, we can then look to see how best we can reestablish certain services and delivery of those services, including the work and study program.
Okay, thank you very much for that, Dr.
Hope. Yes, if I may just add to Dr. Hope's response with respect to the work and travel program. So it has a lot to do with one, monitoring of, well, primarily the United States, UK, and Canada, where we have significant amount of our work and travel students going during the summer. So, and you'll notice that increasingly foreign nations are imposing travel bans at this time as a result of the increase in numbers. It is the hope, though, that, well, by around May, hopefully globally, we will have some sort of a handle on COVID-19 in terms of containment and successfully detecting and treating this disease in the early phase. So it's really difficult at this time for us to say definitively whether or not it will be business as usual, but we definitely know that this pandemic has already changed the global landscape in terms of how we do commerce, in terms of how we do education, in terms of how we are going to do even exchange programs. So it has a lot to do with monitoring at this moment to see what will happen. And I am confident that, well, it depends on really the next few days when the government makes their assessment again, that is Jamaica. And also going forward, all governments globally affected by this thing are making not only day-to-day assessment and evaluation of the spread of the virus, but weekly as well. So we just have to be tuning, and I'm sure, as Minister Terlong alluded to, we will have quite a few of those advisories coming out of the high commissions and embassies as well, because they, to an extent, are some of the biggest partner with respect to the work and travel program. So we just have to keep monitoring the issue at this time, but definitely the landscape of work and travel will change. We cannot say definitively how at this moment.
Okay, understand, Mr. David. Okay, so Mr. David saying it's definitely going to change. They can't speak definitively because it's as if we're entering a new era. It's as if we don't know the sense of direction. It's like getting a new game. For example, you don't know exactly how it works, but you're trying to you're getting to understand. So what I feel will happen is that, as Mr. David would have pointed to, is that over time we will get a sense of direction as to where it goes. For persons who are interested in work and travel, I would ask you just to continue to stay tuned to the platform, because we will pose these questions as well. Continue to pose these questions, and also as soon as we get answers to them as to the sense of direction, we will most definitely share that information with you. Now we're going to move on to another question. Somebody had posed a question in the group. Siobhan Brown had posed a question as to, its question says, is asking about the community colleges and government institution like CASE. How if assistance will be given to those persons to move off campus? I think, Minister, that would have been addressed directly to you. If assistance will be given to community colleges and government institutions, for example, like CASE, for students who can't really afford to move, if you will give some form of assistance from the ministry, or the ministry will be giving any form of assistance for those persons to return home who don't have the financial resources or whatever means to return home. I know, for example, the University of the West Indies is providing resources for their students to return home, buses and along, but that might not be the situation for other institutions. Is there any plans from the ministry standpoint to assist with students in these situations?
All right, Everton. So again, once the concerns come to us, then certainly we will have to consider the concerns and find the best solutions to address them. All right. So that concern has not come to us as it relates to students at CASE, etc. But I will certainly note it and have it discussed with the team.
Okay, so we most definitely compile all the concerns, Minister Terlong, and we will, as I said, we'll have recommendations from the forum based on the questions that we're having here. That as to some of the concerns, and then we get the numbers to back it up as to how many students are requesting X or Y services, so that you can have a greater understanding.
Yeah, but Everton, what I must say though is that we want all Jamaicans to understand that there will have to be a new normal, especially in terms of how we treat with each other, how we treat with combating new diseases, and certainly as the world changes, as technologies changes, as new diseases emerge as well, these are things that we have to think strongly about. But certainly what we want persons to understand is that containment and proper hygiene are the two best ways to combat the coronavirus. When we look at the Asian countries and what has happened in Asia, we look at Taiwan, we look at Hong Kong, we look at Singapore, certainly we see that the numbers there have fallen exponentially. They have literally went into a sort of, like zero tolerance containment mode, disinfecting whole cities, twice per day. But it needs the compliance and cooperation of all Jamaicans. So when we still hear of public gatherings and have like 300 people congregated in a particular place or 500 people congregated in a particular place, we just want all Jamaicans to take it seriously. The fatality rate is minimal. It is, but even then, you might not be at risk. Millennials might not be at risk. Then you have older parents, you have older family members, You might have other millennials who have respiratory illnesses, asthma or something else that you're not aware of. So whilst you think that, whilst there are persons who might think that they're somehow invincible or that it's not fatal to them, always remember that there are other persons that you might come into contact with and that you might be asymptomatic as well, but it does not mean that you cannot pass the virus to somebody else. And that person could be an elderly person or one of your sick classmates, etc. So again, just to exercise caution. Whilst we stress the need for not to panic, we also stress the importance of self-isolation and containment. I must also speak about the persons who are the charging ridiculous prices. Again, it does not need to happen. Again, we have spoken about the fact that a lot of these in terms of the detergents and sanitizers, we produce them here, and our local manufacturing sector has indicated that they will work 12 hours beyond that if they have to ensure that we have sufficient supplies. So there's no need to increase the prices. There's no need for persons to be buying, 10 bottles of Lysols when they really only need one. And as our Prime Minister has said repeatedly, it makes no sense that you have the only clean hands in Jamaica and then you go there and you have to interact with the public. What's going to happen then? So we must avoid selfish tactics. We must avoid divisive tactics as well. What we need right now is to recognize that it's one Jamaica for all Jamaicans, and that must be the mentality going forward.
Everton, you're muted.
I'm sorry?
Sorry, somebody just made me aware that I was muted. Thank you very much for that answer, Minister. When you have raised your hand, feel free to ask your question.
Sure. Good morning, everyone. Morning, Minister. So would you kind of provide an update as it relates to level 3 of the Ministry of Education's emergency in education plan, where it was discussed that they're exploring partnership with telecom providers to provide data for free at specific times of the day, and for those in remote locations for one-on-one communication to be provided for data cards, etc.
All right, what I will say at this time is that we have been thanks for the question, we have been in touch with Flow. Flow is in fact one of our partners. So they will be providing data service for free. Certainly all government agencies to access any government service, all those websites are in fact free as well. We will be developing more measures as we go along. We just announced the closure on Wednesday. Was it Wednesday or Thursday? Sorry, we just announced the closure on Thursday. Sorry. So certainly we have we've been in meetings nonstop. Putting further protocol together, but certainly what was important for us was to sit down and to take that decision to close the schools. It was not, and I will use this opportunity to say to Everton and all our persons who have joined it, it was not an easy decision. We had to give thought, obviously, to the fact that parents are going to be at work. The country must go on, the economy must go on, all sectors of society must in fact go on. We also gave consideration to even at the prep and even at the primary school and basic school level, about students who are on path and everything else, and recognizing that school was one place where many of them might be having a proper meal even once for the day. We gave a lot of thought. Sections of the population, of course, close the schools, why the schools can't close? Persons were taking swipe at government ministers, say that, oh, we weren't closing schools because our children going to private schools and have private tutors and nothing of the sort. My children go to public school, so it's and other ministers as well, So this is not about being homeschooled or whatever. It was what was best and based on the information and based on the threat level of the spread. So of course we have to be guided by all those things. We have to be guided by the Ministry of Health as well. And so once the decision was finally taken, it was because we recognized the possibility of a spread within the education system based on the traces that were done with patient zero. So again, even when we took the decision, we understand that there are some persons who are like, but Lord of God, why is school closed? And and people seem to think that as government, there are some, like, okay, we can close school because, oh well, persons, they automatically go to this very kind of banal kind of thinking that, oh well, they have helpers and nannies and everything. And it's not the case. School is a big meeting ground, and it would be irresponsible of us as a government, Everton, not to have made that decision at the appropriate time based on the information that we had, based on the advice that came to us from the Ministry of Health. And so it's all about cooperation and understanding. And certainly what we have said as a government is that we will be assessing the situation over the next 10 days, and we will be advising further as to the next steps. But for now, again, our partners, Flow and one-to-one learning, I know that our CXC and CAPE students, they're also concerned, but material is available. We are providing the seminars. Our regional directors are in constant dialogue with our principals and our, and admins from our schools across the country. We want to ensure that education in Jamaica is not disrupted. When we look to Canada, Hong Kong, they've closed schools. Italy, they've closed schools as well. It really is it really is in keeping with best practices to ensure that we take the relevant steps. Again, it's safety for everyone. And right now, the safety of all our Jamaican students is paramount for us as a government, as an administration, and also to ensure that education is not disrupted. Hence all these online platforms and online learnings. Again, including this very webinar that we're having here. So again, big up to the organizers at JUTS.
All right, thank you very much for that answer, Minister. There's another question that has been posed. We will just wrap up this section in another 10 minutes because I know persons have questions and also persons too. So, I know if I'm not, sorry, give me a second, just looking at the questions that have been raised. Anastasia? 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 And she's probably trying to turn on her microphone. Give me a second. Let's see.
Hello, good morning.
Great. You're hearing us?
Are you hearing me?
We're hearing you.
Okay, good morning. So I've raised two questions. The first one, Mr. Terrelong made reference to e-learning for tertiary students, but can the online classes facilitate all students from their respective classes? The second one, if and when provisions are made for online classes, how will students from deep rural areas without internet access be facilitated?
Okay, good questions. Minister, I'm assuming that she's directing those to the minister?
Yes.
Okay. Dr. Hope and Dr. White, I hope you guys don't feel a little, we
left out, right?
Left out. I know they're probably directing to the minister, the ministerial powers to help to make decisions along that line.
All right, so the as it relates to she mentioned the e-learning. Yes, right. All right. So again, we will develop. Again, we are in constant dialogue with principals and administrators. We've actually started on Friday. We started training the first cohort of 180 teachers in online software, online techniques, online training methods, and everything else. We will be uploading more material, more work material, etc. So those training seminars are actually ongoing right now. Again, as I indicated, one-to-one learning is on board, or regular e-learning. I've spoken to other internet providers who want to participate at the primary level. We do have Edufocal as well to make sure that the full gamut is taken care of in terms of our learning capabilities. naturally we will be improving those as well as we go along, because the truth is we whilst the break now is for 14 days, it could be extended based on the determinations that are made by the Ministry of Health and by the Honorable Prime Minister. So we will update the nation, as I indicated, in another 10 days as it relates to school closure. But we've done further assessment as it relates to our technological needs, and we have done a preliminary assessment which says that an additional $50 million is in fact needed to ensure that we extend the broadband, so that we extend the internet capabilities to all our students. Physical material will be provided also for those persons who do not have internet access. But again, if you have your smartphone, Flow is doing an amazing job. They have, I said, come on board initially from day one, and they're giving free internet access as well. So students with those concerns, if you log on your Flow platform. Again, our ministry portals, they are also free. Access to government agencies, government information, those platforms are also free. And the second question, Everton, could you remember the second question, please? Or did I answer both one?
Yeah, you did. You answered.
Okay.
Thank you very much, Mr.
No, thank you. But once Everton, and it's very surreal. It's so surreal. I will admit this is my first Zoom meeting. And I can tell in the Everton style wiki this morning. He's like, boy, minister, it's easy as 1, 2, 3. You just have to just log on and then you put in the user ID and click download. And yeah, I'm style wicked. But on a real though, I'm so impressed. I really am impressed that that I'm living in the 21st century. And and just that we're using the full gamut of our technology. 100 people, 100 youth tuned in, to have a webinar about the future of education in Jamaica at the tertiary level. I am very, very proud of our government. I'm proud of our youth. I'm proud of our teachers and our net providers, who've all just been I'm just doing a great job, so big up on yourself, man. Big up to everyone for recognizing the challenges, but for recognizing that together we are stronger, and that if we face them together and if we work together and not trying to gain one-upmanship or to bring down and tear down and carry down, then that is how we overcome as a nation, as a people, and that is how we keep our education undisturbed, uninterrupted. So big up on yourself, man. I'm very, very proud. I'm very, very proud.
Thanks for answering the question, Mason. I appreciate the compliment. I most definitely say this wouldn't have been a possibility without the JUTS team. I would never try to take individual credit, because we had an emergency meeting for our annual meeting. So happened to fall 3 days ago. We decided that we need to have an emergency forum to discuss these issues that we're facing currently. As you understand, we have never seen something like this, and the team decided that, hey, we need to have a forum. And we just made the necessary arrangement, and here we are. I'm really happy to see that there are so many young people interested to know what is the direction that will be taking place, for education. What is the direction for our country? And as you pointed out, you're living in the 21st century. You're living in this, the new age, and I'm actually happy to be a part of it as well. But we go into the next question.
Yes, but Everton, just before you go, let me just add to the minister's response. So the minister would have noted that all GOJ websites would have been, they are 0 rated. And in response to Anastasia's question as well, in terms of online classes and for rural area young people who might not be able to access the internet, I just want to use the opportunity to, it's unlike at the secondary level where the ministry have more direct oversight responsibilities for the school. It is really up to, not up to the universities alone, but it's more so the responsibility is heavily on them for them to partner with our internet service providers locally to perhaps have such similar agreements. So perhaps, especially in this time, maybe for university websites or through their e-learning platforms to be 0 rated. because we are cognizant of the fact that data costs money, and not all of our young people may have that sort of wherewithal or resources to cover a data plan to maybe facilitate or have a online class which may utilize a lot of data. So I would suggest to the JUTS and also from the ministry, when in dialogue with the university, to prompt them to engage our internet service providers to see how much, or to just have a greater partnership with respect to that, because I know that if the university's website, well, at least for now, it may be zero, that would go far way in terms of reducing reducing the cost and making education way more accessible to young people who might have that challenge because of them not being able to even purchase a data. And we do know rural area youths are while they might not have access to a desktop, a phone, as we are witnessing right now, has the same capability to facilitate or have an online a forum. I know VTDI has Doodle, NCU has Orion, so they all have their online platforms in place. The question is more so, how can young people have perhaps more affordable or data-free access to these learning platform for now? So that's a thing JUTS may want to bring through the institution, student governing body, to have that sort of dialogue with internet service providers. So a similar arrangement can be had as well, because as Minister Terlong cited, most of these arrangements are for secondary levels. And we're trying from the ministry at the same time to have these arrangements as comprehensive as possible. Mm-hmm. And some of these can be applied at the tertiary level.
Well, while you answer that, Mr. David, just to answer as to what I also know from some of the tertiary institutions. A number of the institutions are actually in the process of developing the full capacity to host the online classes. I know, for example, the University of the West Indies is currently looking, I think one of the things that they're looking at is that they need a month or a month time to develop a fully online platform that will be able to host the entire university online. So I know that the University of West Indies is actively looking into that. I know we are also here with the president from UTech is also here, could also speak to what is exactly happening for UTech. Khalil, is there a full platform being developed at UTech? While Khalil probably figure out how to unmute his microphone, we're just saying though that I know most of the universities are actively looking at how they move to the online platform. As you also spoke about, Mr. David, the idea of how do we facilitate persons in rural Jamaica who might not be able to have those internet access. One of the things that we're looking to put forward is for our internet providers, in particular, Flow and Digicel, to look at how they can facilitate providing possibly free internet to persons through a particular platform where they may be able to access their portal so that they can view their videos, that they can view their live streams for their classes, and submit all their assignments. So it will be restricted, if not to certain things that you can use free internet for, but it might not be allowed for you to use other platforms that might not necessarily be related to school. So that is also something that we want to put forward to Flow and Digicel. As we currently know, Flow is providing free internet, as the minister would have stated. Free internet. You can go on the Flow platform, download the Flow platform on your phone, you can have free internet. I think you have to have a Flow phone. If I'm not, I will get the correct information about that. So I think there are developments being made to make sure that, the facilitation of education online is a possibility, a real possibility. And I would tell you definitely to look forward to that. So, Mr. David, we are going to move to the next question. We have 3 questions. We're going to take those 3. Khalil?
Yes, hear me now?
Perfect. You can just go ahead and just adjust what is happening at UTech as it pertains to online.
Yes, so
Houston.
as you know, I'm not really fully aware of what is taking place so far due to the current elections. However, the information that I received so far is that we are in process to having the courses, materials online via our online platform, UTech Online. And the issue that students have given or said to me is that they might be in areas where there are no internet. So I'm really happy that I'm hearing that Flow will be providing the services for free. I'm hope that my question, Dory, that is, would it be what areas will be impacted with this free coverage so I can inform the students better? But as it relates to UTech, we're going to have a meeting on Monday to fully discuss our online capabilities as well as our steps to be taken after the virus has left.
So you're asking, sorry, go again, you're asking how...
Yeah, man, the areas that will be impacted by the free coverage of Flow, because yes.
Right, I think they're currently providing free internet to the government for all their platforms. So all the government platforms are free. So all the government websites and they are free. There's also the free toll line 888-1-LOVE, and one as in the spelling ONE love. So 888-ONE love. So 888-1-LOVE. You can call that number if you have a suspected case in your household or whatever might be the case. It's toll free. You don't need any credit or anything of that nature. You can just dial that number and you get direct access to a call line that can help you to deal with any situation relating to COVID-19. We will reach out to Flo Khalil. I can't speak to exactly how what plans will be in place, but I know that we will most definitely be recommending to the government for them to see how they can probably negotiate with Flo to possible see how they can assist with persons who are in rural Jamaica in particular, because I know that is probably mostly the difficult situation.
Yes.
Persons who are in those rural areas who are facing that kind of situation. So I see the minister is here, and I know the minister can probably would want to address that again.
Yes.
Yeah, you know, what I will say is that we would, first of all, there are certain corporate entities who have come on board, and I have to big them up, you know, and they've come on board in a big way, recognizing that, the education of our students it belongs to all of us. You know, education is not just the sole purview of the government. Education, we have to treat education in a more holistic, in a more national way, by recognizing that the government alone can't think of everything and can't do everything. So I would definitely want to call upon more private companies, more of corporate Jamaica to say, hey, sponsor a school, sponsor a particular program. There is one particular company, but if Edifocal can't, I'll allow Edifocal to say, but there's one particular bank, who's helping Edifocal, who is saying, hey, Edifocal, we will help to fund you so that you can help the children, certainly at the PEP level, grades 4, 5, and 6, for free. So Edifocal, I'm sure in due course will pick up this particular company, but we need more companies like those, Everton, to come on board and say, hey, we will cover the cost, even if it's over the next 14 days, even if it's over the next 20 days or so. But certainly we as a government, we will do our part. We do recognize the importance of empowering and educating our young kings and queens. And as I indicated, there's a preliminary assessment that has been done that says an additional $50 million is needed to shore up, to boost up our internet capabilities, certainly to ensure that more material goes out to our students. Again, if you have a smartphone, you can log in on the smartphone. If you don't have a tablet or a laptop, and again, if there's no internet service provided whatsoever, let us know the areas so that they can be addressed. 1 and 2, there are physical
Minister? No, we're not hearing the minister.
Can you hear me?
I'm hearing you now. Sorry about that.
Right. I'm saying we're also encouraging. So what Jamaica is doing now is, in addition to the ideas that we come up with and the protocols that we devise, we're also looking at what we consider best practices around the world, to see how some of the countries, and the truth is the Asian countries really have adopted some of the best practices to combat the coronavirus. So when you look at when you look at the cases in Asia, you're seeing like very, very minimal cases now, being discovered on a daily or certainly on a weekly basis, simply by virtue of the containment practices that they have taken, the isolation practices, and also in terms of, like cleaning societies and so forth.
Mm-hmm.
But we'll be encouraging teachers also to embrace the platforms, they have, but we've been encouraging more teachers to embrace the platforms. Other teachers who want to come on the program or who want to assist, please let us know. I had one teacher from Mandeville who messaged me this morning on Instagram to say, hey, Minister, how do I get to be a part of this 180 teachers, or, when is the second batch? Because I want to be learned. I want to learn as well so that I can conduct these things. There is, we have to big up Chad Rattray, your namesake.
Mm-hmm.
Chad Rattray, he's doing, I think it's a communications class. He's doing that online on his Instagram. He's going live to teach, I think it's communication studies to CAPE students. So I know, Everton, that you're going to go online maybe by tomorrow or certainly next week, and you're going to be teaching. You're going to be doing a 1-hour webinar for some of our CAPE students as well, or maybe some of our year 1 university students. So these are the things that we can in fact do to spread the knowledge. Knowledge is infinite. And the best way to even improve your knowledge is to share it with others, because, and so in other words, we all need to be creative and we all need to be selfless at this time to ensure that the least disruption to our education system happens. And so again, we will continue to do our part, but we're young king and young queen to join in the fight. And we're calling upon corporate Jamaica as well to join in the fight also.
Okay. Thank you very much for that, Minister. We're going to move to the last 3 questions that we have here. Mullins?
Hi, can you hear me?
Yeah, man, we're hearing it clearly, Mullins. We actually posed some questions. We're asking persons also try to pose questions about the COVID-19 itself in terms of how the virus is affecting us in terms of, health-wise. Also pose questions to Dr. Hope, and Dr. is also here with us, all right? And Mr. David.
Okay, all right, great. So I am here in London, where the cases seem to be coming to Jamaica from. And everybody calling me, Tijana, how are you doing in London, blah, blah, blah. So amongst the evening scholars here, as you would have known, there are 18 of us. Yeah. And we're looking around us and we're seeing some classmates even leaving and going home. And what I'm wondering, not just for London, but tertiary students in the diaspora generally, in Trinidad, in the US, depending on how terribly their programs are affected, they may be thinking of going home. I know that right now, like for example, we couldn't come home because of the ban for persons in the UK. But what I'm wondering, when we're out of containment or whenever we decide that we can take students home, students who want to come home, if there are any considerations for students like that, because there's quite a number of Jamaican students in the diaspora. So I'm wondering if there's any thoughts about that. Additionally, some programs that are largely lab-based, and I'm talking about also Jamaica now. There are some programs that are largely lab-based. So even if there are online classes and forums, they might be significantly impacted in the extent where their year is largely interrupted. Some exams and assessments, according to the nature of those, it's a challenge to have them online. So I'm wondering if there are any thoughts around what will happen, depend on the extent to which people's year is interrupted. And lastly, this is mostly to Dr. Hope. Can you make any projections? I know it's largely unpredictable, but as to how long you see us having an impact, because if this extends like another 2 to 3 months, if you're a part of a program that is largely face-to-face, or need large face-to-face interaction, your year might be disrupted. So I'm just, wondering what are your projections? Because exams and assessments will be impacted. It's not just to have your class online and problem solved.
Okay. Thank you for those two questions, Mullins. I hope you stay safe in London. I know you're as one of the Chevron scholars. I really hope you stay safe. As you stated, a lot of the cases are coming from London to Jamaica. That first
almost 800 cases now.
So I hope you're staying safe. I will allow Dr. Hope to answer the first question. I know Dr. White, if you'd like to chip in as well, he could probably chip in on that question. And then I'll allow the minister to answer the first question that was posed after.
All right, thank you for that question, Ms. Mullins. And as you rightly said, it's quite difficult to project the impact of COVID-19 on Jamaica, and even more difficult to try to give a timeline. I think the approach being taken by the government of Jamaica and how they've managed education in terms of suspending classes for at least 14 days and then doing an assessment after 10 days is likely the approach that will be done moving forward, because it's a dynamic situation that will change from day to day, from week to week. The projected impact, though, on education is even more difficult to gauge, because it unfortunately coincides with a lot of the significant milestones in education, PEP, end of term exams for tertiary level students, end of year exams for secondary and primary level students. All of these tend potentially to be impacted. But my personal projection, I believe that the next 14 days will give us a good template as to whether we fall in the group of countries like Italy and those countries where the exponential increase continued, or as Minister Tertiary included the countries like Taiwan, Hong Kong, where they were more proactive and aggressive in their response. So I believe that based on the trajectory I'm seeing now, Jamaica, the response of the government, the Ministry of Health has been quite appropriate and aggressive. So I hope that cases don't exponentially increase over the next 10 days. And if that is the trajectory we follow, hopefully within another month's time, we would have contained the virus sufficiently to return to some level of normalcy. So it's difficult to give an exact timeline as to when things will return to normal, but I hope that based on the number of cases we've had and the response of the government, that we follow the trajectory of those countries like Singapore, Hong Kong, Taiwan, where they've been able to contain the COVID-19 virus.
Thank you very much for that, Dr. Hope. I don't know if you want to chip in, Dr. White.
Yeah, hi, everyone. So I think Dr. Hope has basically said what is appropriate. In terms of how long this virus may affect us, again, it is difficult. What we need to be more concerned about is how quickly the virus spreads. Because if you really think about it, if the virus spreads quickly, then time period it affects us may not be very long, but the impact of it as it spreads exponentially may just make such an impact that it is difficult for us to one, treat it in the time period it is affecting us, and two, to recover from it. I'm not sure if you have seen a graph. There is a graph that has gone around that shows the impact of what can be of COVID-19 if it exponentially infects a population versus if it is controlled. And if you notice, the curve that affects, where it affects exponentially, is a pretty narrow curve, meaning that the time period is pretty short, but the level, the level at which persons are being infected actually supersedes what the health sector can accommodate. Mm-hmm. And so what we want to do, and I think as Dr. Hope said, the ministry has acted appropriately, is try to lengthen that curve, but decrease the threshold, decrease the magnitude, the amplitude of the curve, so that while we are having cases maybe up until June, July, the level of infection and spread is controlled, and so our health sector can actually deal with it. So that is the primary concern here. Can we appropriately act and contain the virus before we have a situation like Italy and even the United States, where there is exponential spread of the virus?
Okay, all right. Thanks for answering that, Dr. White and Dr. Hope. Minister, I know there was a second question as well. Can you address that? I know she had posed it directly to you. Could you just speak to that for us, please? Mr. Davey, if you'd like to address that as well, I know you might have the expertise, given your position as well, to speak to that as well. Minister? Mr. Davey?
Oh yes, Everton, I stepped away for a while. Could you repeat the question again?
Mullins, could you go ahead and repeat the question?
No, it was two questions, Davey, Mr. Davey. There is a number of students in the diaspora that may be thinking about returning home. I know they can't return home now, but just in case of if there's any considerations for them. And in the event that the virus affects us, let's say up to July, where the paper exams can't occur, students who have programs that are largely lab-based don't get their labs done. Is there any considerations in terms of what will happen? Because this may look like things going over into next year's academic year. Just, if there are any considerations around those matters, because just online classes alone may not resolve all of that.
And she's talking to in relation to international to student study. Yeah. As she said, okay. That, all right? That's
Yes, I got the context. Okay. Yes, so we are aware that online platform has its limitation, especially with respect to examination. And the ministry and government on a whole have been considering also worst case scenario. Say, for example, we are not, God forbid, unable to continue to the degree we would want to, and it pushes back the school's curriculum, well, locally and even globally, by a few months. Then cabinet will have to make a decision locally on that, but they haven't reached juncture as yet because they're monitoring the situation on a day-to-day basis. And after the first 10 days have elapsed, then they're going to convene again to discuss the implications or consequences, whether negative or positive, on how best to respond. So say, for example, if we find ourselves locally in a situation where we'll have to continue to protract the delay or the resumption of face-to-face educational services at our secondary and tertiary level, then they'll now have to go into deeper consideration or deliberation as to how best to respond. For international students, though, I would say or suggest that you keep in contact with your High Commission in UK to get update as to how best the government of Jamaica is responding, and for even repatriation purposes. For a while, Jamaica have imposed the travel ban on the UK. Permanent residents, diplomats, citizens will be allowed to re-enter the country. However, they may be asked, they may be quarantined for the 14-day on the condition perhaps that they are suspected of being a carrier of the virus. But at this juncture, my suggestion to international students abroad in the diaspora to just keep in contact with their high commissions in their country of study, because the Ministry of Foreign Affairs, as you may be aware, Kishona, have been monitoring the situation with respect to international students even more closely for those in Asia. I'm not too sure if we have started that sort of close dialogue with respect to UK or even the US or the countries in the Western Hemisphere as yet. But I know if that is triggered, if the event triggers the situation wherein we may have to extend this suspension on face-to-face educational services, then the Ministry of Foreign Affairs will make an attempt to be in closer dialogue with our High Commission as to how we'll treat with the issue for our international students. But I can't speak definitively at this time with respect to any specific measures, because the measures are basically informed on our well, the government of Jamaica day-to-day monitoring, and the monitoring come after the 10 days have elapsed.
Okay, all right, thanks for that, Mr. Davey. So Mullins, I know he's particularly mentioning the importance of staying close to the High Commission, and how valuable that might be in the process until things are determined. As he's basically stating, there's no way to directly say how things will be managed, because we have never faced a situation like this before, and we're trying. And I guess the various individuals with the different responsibilities, whether it be through the institutions, whether it be ministers or commissioners, they're trying all playing their unique role in terms of how do we address the situation. I know the government in particular will be going back to the table, as Mr. Davis said, to address how do they tackle this as well from their standpoint. Minister, I don't know if you wanted to chip in on this, or should I just go ahead and go to the next question? You're muted, Minister. Go ahead, Minister. I think it's unmuted now.
All right. No, right. No, you can move to the next question so we get to hear from as many persons as possible.
All right. Hudson?
Yes, afternoon.
Good afternoon.
Your name and question. Yes, Rene Hudson is the name, Northern Caribbean University. Now, my question is pertaining to our nursing students that we have on clinicals at the present moment. Now, I want to know two things. Number one, as it pertains to their safety on these wards, what are the measures that we have in place to ensure that our students are safe? Because to date, they are still out there. Number two, if it's a case where we have to pull them from the clinicals that they're currently on, what partnership can the ministry do with the nursing council to ensure that the hours needed for matriculation, that it is actually met so that these students will actually complete what they've started and be able to move on further in their program of study?
Okay, all right. So the question is posed to who directly? I'm assuming it's the minister?
Yes, correct.
Okay, Minister, feel free to go ahead.
All right, so all right, hi, how are you doing? Hope all is well. Thanks for the question. So as it relates to all our students who will be having, you know, in terms of practicals to do, or in terms of the you know, particular hours that need to be done, certainly we will be speaking with the relevant councils to ensure that the appropriate decision is in fact taken. Mm-hmm. All right, so the relevant bodies and the relevant administrators, they will be briefed. Again, it will be a collective approach as it relates to their opinion, our opinion, the best way forward. Again, best practices must be adopted. In no way do we want the lives of any of our students, whether at the primary or tertiary level, to be put on hold for another year. So certain measures will have to be taken, whether it's by virtue of maybe extending semesters for 2 weeks, whether it's by virtue of using in-class practicals and so forth. Take, for example, where PEP is concerned, one of the things that we've looked at is that there have been several internal assessment tests that have been done, and certainly a decision will be made as to the way forward. Do we add extra time to the semester? Do we use some of the classwork, some of the class tests? You know, but as I said, within the next 10 days, we will continue to do the assessment. We will advise the nation, and all our regional directors and offices, they remain open and they will be in constant dialogue with administrators so that the best practices can be adopted and that the proper solutions can be implemented. Because again, the education of our students is of paramount urgency for all of us, and we don't wish for it. It is not our intention for anyone to be kept back a year, but certainly universities, etc., they will have to weigh in terms of the different programs that they have and the different decisions to be made in terms of accreditation.
All right, Minister. Thank you very much for that. I see a number of persons. Well, the questions, I'm not seeing any hands. I'm not sure if there are any other questions. We're coming close to the end. We had budgeted 2.5 hours for the meeting. And I said budgeted, meaning that one of the things that we want to do is to, one, bring awareness. We had 2 main objectives for this forum. One, to bring awareness to what is COVID-19 and how, as individuals, we can play a unique role. Dr. Hope would have spoken about COVID-19 and how we can play a role. And 2, just to answer those questions that students are having. What we will do is that as you look at the agenda for persons who are seeing the chat, the questions from here will be tabulated, and we will also look at the recommendations that were made. And with all those recommendations, we will have them put forward as we come closer to the end. There are some more questions, so we allow persons to go. Could you just show a raise of hand if you have a question? There is a button that is showing a hand like this. Just feel free to click that button and to pose your question. I know a number of persons have just joined us. For persons who are just joining, welcome. You are joining closer to the end. What I will also ask before we end the forum is for Dr. Hope to just possibly just go back over some of the things that he would have said, or Dr. White to also reiterate some of those things that would have been said for persons who are joining late. But we are coming to a close very soon, so we'll allow the last few questions to be posed, and then we will come close to an end. All right. I know Renee, and also you may email your questions and suggestions as well if you didn't get to do it in this meeting at jutsja@gmail.com. JUTS is JUTSJA@gmail.com. My name is Abaton Ratri. I'm the president of the Jamaica Union of Tertiary Students, which is the governing body for the tertiary institutions across Jamaica. So I'll just allow other questions to go forward. So I guess we have answered all the questions. Not seen any hands. Not seen any hands. So I think we have basically answered, if not all the questions that would have been posed. Assuming there are no more questions. So we'll just ask Dr. White, if you don't mind, and well, Dr. Hope, could you just quickly reiterate the things that you would have mentioned in relation to COVID-19 for persons who are just joining, just the fundamental things that we need to be aware of, what is COVID-19, just to give us a basic background of what it is we're facing. I know you have gone through it already, but just for the persons, I said, who are just joining, feel free to just go ahead now. And Dr. White, feel free to join in as Dr. Hope speak about it, all right?
Sure. Thanks again, Mr. Ratri. So just in summary, as was said before, COVID-19 is a global pandemic that's 74 days old, and in the past 74 days has infected more than 142,000 persons with 142 confirmed cases. And we know now it has been diagnosed in Jamaica, where we have so far diagnosed 8 cases in the last 3 to 4 days. So it's of something that is not just of global significance, but also of local, national significance as well. And the most important thing is that you protect yourself, you protect your family, you protect your organization by adopting practices of proper hygiene, adopting frequent hand washing with soap and water for at least 20 seconds, adopting hand sanitization with appropriate hand sanitizer with at least 66% alcohol content, more than 60% alcohol content. Now you also practice social distancing, maintaining at least 1 meter, 3 feet distance, where you...
Dr. Hope, give me a second. I just want to, the minister has to go. I want to just thank the minister for joining us. We have a very busy schedule, but we really appreciate you coming and answering the questions that most of the students will have here. We will pose all the other questions that they put forward in our where we'll put those questions to you, and also we'll put forward the recommendations that we're putting for from the tertiary space itself, from the various students. That we would like the ministry to address, and also how we believe they could be addressed, and also those questions to the tertiary education. So thanks again, Minister, for joining us. I know you might have a few words before you go. So Dr. Hope, I hope you just allow him to just head out.
Yeah, again, so Everton, again, just to thank you and the team at JUTS, you know, for this morning's web forum or webinar. It certainly has been, again, as I said, very, very proud moment just to see the youth of Jamaica take a very proactive approach in this manner. And just using technology, you know, again, we must consider our safety first. And, you know, the future is changing, technology is changing, and certainly learning must change, and how we, our entire approach to how we educate our population, that certainly will change as we see new viruses, new diseases, you know, as we see the need to move an education platform into, you know, to the next level where even examinations does not need to be person to person or that personal contact, simply because of what the future might hold in the case of new diseases and how they might be spread from person to person. But again, technology is an amazing tool, and technology will keep us going. As a government, we will continue to do all we can. Just a reminder again, asking persons, you know, not to panic, just to exercise caution. Proper hygiene, we can't stress it enough. Wash your hands, limit your personal contact. You know, I mean, we're doing, you know, between the Prime Minister, he's been doing, you know, the elbow bump. In fact, that has now been the accepted norm across the world. You know, I'm a very tactile person. Even when I'm in the constituencies, you know, it's hugging and shaking hands and everything else. I'm genuinely like that. But, you know, we all now have to think about, you know, not just our personal space alone, but also our families and, you know, our parents who are elderly, you know, because again, you know, millennials, you might be invincible, but remember also that your parents and your grandparents and friends who you have who might be suffering from respiratory illnesses like asthma that you might not be aware, hypertension, diabetes, and so forth. So it is the time for Jamaica to unite as one Jamaica. Divisive tactics will not assist us. Fake news will not assist us. Certainly as a government, we will ensure that the population has all the information that we have, because there's nothing to be gained from keeping information. You know, there's nothing to be gained from not letting people know what is happening out there and what steps they must take, you know, to ensure the safety, not just of themselves, but all of us as Jamaicans. So to the young people of Jamaica, continue to play your part. The future is now, and how we react in these, the first days of the virus in Jamaica, will certainly determine our ability to properly quarantine and to properly treat and care for those who might fall ill. Education is the best gift you can give to yourselves. We continue to do our part to ensure that you have that gift. Blessed love and guidance to everybody. Have a great day.
And thanks for joining again, Minister. Have a good day. Dr. Hope, you can finish off what you can go back to what you were saying.
Sure. Thanks again. So just to finish up on the hygiene, as we had emphasized before, proper hand washing techniques with soap and water, proper hand sanitization with hand sanitizer with 60% or more alcohol content, and also social distancing. I don't think we mentioned this before, where you should try to avoid large public gatherings. And if you're in public, try to maintain that distance of 1 meter or 3 feet from the person in proximity to you, and to avoid, again, contact, handshaking, and if you do need to sneeze, to appropriately cover your nose or to sneeze into your flexed elbow as well. And importantly to all of you at tertiary level students and leaders, that you are the response of the nation to this pandemic, and we encourage you to employ these changes to your own personal hygiene and also to disseminate this information to all persons you have in your sphere of influence. And again, thank you. Thanks to the Jamaica Union of Tertiary Students for this opportunity, and thank you for your kind ear as well. I believe you're muted. Yeah.
I was saying thanks very much, Dr. Hope, for just sharing the coming on and just sharing with us. We really appreciate it. I'm sure a lot of students are here who have benefited tremendously from the knowledge that you have just shared about COVID-19. I'm not sure if Dr. White, you wanted to share anything before as we get closer to the end.
I think well, both Dr. Hope and the minister have said what is appropriate, and I think that information is something that we can take back with us. What I wanted to add is that as young people, we have to be responsible. The numbers are outside the youth to this virus. Most of us will have a mild course of the disease. Most of us will be okay if we do get coronavirus. However, we have to still practice these measures, the hygiene measures and social distancing, not just for us, but for our parents who are in their 50s or 60s, or grandparents in their 80s, because they are the ones that are more likely to severe course of disease, and they are more likely to die of coronavirus. Mm-hmm. So our responsibility is not just for us, but for the older persons around us. And also I think Minister mentioned something about focus. We have to be responsible. We share with people what we read and what we try to believe. I've seen so many WhatsApp messages about who in University of China sending message about this and giving us CIA and all manner of things. We have to be responsible and understand that the information that we disseminate must come from our ministry, must come from PAHO or WO or CC, a reputable source. So it's not just some random WhatsApp message that we can just share with everybody and that is gospel. We have to be responsible with the information that we are disseminating, because it doesn't help us in the long run, especially us in the healthcare system, when we have to try to treat people. And some persons might have the disease, might have severe course of disease, and they're sitting at home taking garlic and all manner of things. Do you understand? So we have to take that responsibility of ensuring that we're disseminating correct information, disseminating information from reputable sources, and also ensuring that we are looking out not just for us, but for people around us.
Okay, all right. Thank you very much for that, Dr. White. Thanks again, Dr. Hope. Mr. Davies, is there anything you'd like to say before we get closer to the end? I'm assuming Mr. Davies would have stepped away from his phone.
I'm here. Okay. I'm here. I just had to unmute. But I just really want to utilize the opportunity to commend JUTS for facilitating this online forum, and to second all that the minister would have mentioned, Dr. Hope and Dr. White would have also mentioned, really. That's all I want to say. We would have discussed much, and they were very much relevant and practical matters we can apply in our daily lives, in how we respond to this global pandemic at home now. So thanks again to JUTS for facilitating this session and pushing forward with the information dissemination on how we should really treat with responding and containing this thing. So kudos again to you, to yourself, Everton, and your team. And thanks to Doctors White and Hope and the Minister Tertiary for making himself available for just chatting with us and discussing the issues.
Okay, thank you again, Mr. David, for joining us, and we do appreciate the compliments. I personally want to thank the team, in particular the JUTS team, for doing the necessary preparations, making sure everything is in place. I would tell you it's a real team effort, and I really want to thank the JUTS team for playing their part. You know, it would be unfair of me to sit here and say, you know, it all took place through my hands. You know, it was really a team effort, and I really want to commend the JUTS team, especially the communication department and the secretariat for their work in getting out the information and making sure that the content, you know, the flyers and everything were, you know, was ready in time. For all the persons who joined, again, we really appreciate you coming on. You guys played a very important role in it. You guys play a very important role in disseminating that information that you have, you know, garnered here today. So I ask that you will use that knowledge to help, you know, going forward, as would have been stated, several things: how long you should wash your hands, importance of understanding that you play a key role in preventing the spread of the virus. And the better we work together as a country, you know, the better we are in helping to contain this virus. Just to remind you of some key things. All government websites are free. You can access all government websites free. You don't need no internet. You don't need no service or data to access government platforms. They're all free. So they're you can just go on them. So any platform, whether the Ministry of Education, the Ministry of Foreign Affairs, the Ministry of Finance, whatever it is, those platforms are free. There's a toll-free number. It's 888-1-LOVE. 888-ONE-LOVE. That's a toll-free number. So if there's a situation within your home, or you know somebody who might be affected in some way or showing symptoms of the coronavirus, it is a free number, a toll-free number that you can call to just voice your concern, and the government will take the necessary precautions to try to deal with that situation. If you have any other questions or concern that you'd like to raise, feel free to email them to JUTS. It's Jamaica, it's JUTS, JUTSJA@gmail.com. JUTSJA@gmail.com. So feel free, guys, to email any other questions. A number of questions have been answered here today. This recording will be available online for persons who didn't get to tune in. We were oversubscribed for a very long time. We had reached our maximum number of 100 people a long time ago. We see a number of persons are leaving now as we get closer to the end. But we really appreciate everyone that came on today, and we hope that the knowledge will be shared. So thanks again to Dr. Hope, Dr. White, Mr. Davey, Minister Terrelong for coming on, and to you guys who came and just gained and just soak in all this knowledge. We really appreciate you coming on to the platform. So guys, as I said again, feel free to call 888-1-LOVE. That's a toll-free number. All ministry platforms are free online, so feel free to utilize those as well. Apart from that, guys, be safe, and thanks again. Have a good one.